Thank you so much for that amazing introduction. My name is Sophia Ambrose, and today I'm going to be presenting a Simon Searchlight snapshot of the MED13L data. So just first off, a little bit about myself. I'm studying, as he said, at Columbia University, and part of the Part of the way that I got involved in my interest for these rare neurodevelopmental disorders was because I'm a member of the women's soccer team at Columbia, and that's really what sparked my interest. And so towards the end of my freshman year, I became a fellow for the organization Team Impact, which matches children with severe illness and disabilities to sports teams and creates a long-lasting connection and honestly just such a mutually beneficial experience. And so our team got matched with a girl named Susie. She is so awesome, and she is diagnosed with K1F1A, for whom Dr. Jennifer Bain created a cure for. And so getting to know this truly amazing person that she is not only sparked my interest for these neurological disorders such as MED13L, but it really gave me just this deep appreciation for experiences of the children and you guys, the families that navigate such complex diagnoses. And so today, I'm really just excited to have had the privilege to be analyzing the MED13L data. Simon's is one of the few large data sets that tracks both medical and behavioral features in a rare Awesome. There we go. Okay. In a rare neurodevelopmental disorder. And, something that makes it super unique is that it is largely caregiver reported, which at this point has been mentioned a lot. That's super important in my mind, is imperative to really, is that better? Okay. Sorry, I talk really loud if it's screaming at you, but okay. Which is imperative to just optimizing the lives of those with this diagnosis. It's really reflective of daily functioning and lived experience, which is what makes it so unique. And while there is some longitudinal data, as the MED13L data set for Simon's started in 2010, it's really critical to follow families in MED13L probands over time, because that can really help to make it a long-term resource for studies. And so I specifically explore the relationships between genetic variants and the clinical phenotypes to try and provide insights that can hopefully aid you guys, the families, the caretakers, and researchers in understanding the complexities of the MED13L clinical spectrum. And so first, just a quick demographic overview of this data set. There were 102 individuals with MED13L, and the majority of this cohort, as you guys can see here on the right, are individuals that are aged under 5 years old. So that definitely has some implications for some of these diagnoses that we'll see later on, such as like learning disabilities, language disorders, stuff like that. And we'll dive into that a little bit. And additionally, this data really helped us to confirm some of the current insight about inheritance in the literature already. The majority of the variants, being single nucleotide variants, are de novo, so meaning they're being seen for the first time, they're not seen in previous generations, and we do want to recognize that a small percent of germline mosaicism could exist in these families, so meaning like some cells might not be affected because variants could arise, for example, in reproductive cells, but not in the somatic cells that are in some of these blood saliva tests that the families might be taking. And so then I dove into some of the clinical aspects of MED13L. And so we can take a look at this data. And this graph here shows the reported phenotypes. And here on the side, we have the most commonly reported phenotypes, the most commonly reported diagnoses, greater than 20% prevalence in this data set. And so this is in order of number of individuals, a number of occurrences out of 102 individuals. We see the green being the yes, unknown blue, and the orange being no. And so each individual is independent of each other. So one person could have one symptom and also another one and also another one. And so really this is important to note that this is the number of number of occurrences. And yeah, so these are the phenotypes. And something that is really interesting is this category that's neuro, right? So what does that mean? That's such a vague term, neuro. So here are just some of the common neurological findings that we've seen in the literature so far. You know, it really refers to the presence of a neurological condition, and this specific category excludes seizures. So common conditions that would trigger a yes here are like movement disorders, hypotonia, we have structural brain abnormalities, balance, coordination problems. So just to give you a sense, whenever we refer to neuro, without the inclusion of seizures, these are some of the findings that would trigger a yes in these surveys. And so it's important to also note something that really stood out to us was this blue category of unknown, right? So this unknown existence we see largely in language disorder and intellectual disability and learning disability. And this, first off, may indicate, you know, some uncertainty, some hesitancy in these measurable variables for diagnosing each. But also, we really need to go back to that beginning when we talked about age. You know, age has such a huge impact, as screening for intellectual disability doesn't start until age 5. So any diagnoses of intellectual disability under the age of 5, first off, may not meet formal diagnostic criteria, but rather just be a representation of early symptoms or clinical suspicion, right? So that could account for some of the unknown reporting, as that was definitely very interesting when we put all this data together. And so also these high rates of missing data, right, suggest that there is a need for more standardized behavioral and cognitive evaluations. And so that's one of the wonderful things about today, is that it can really help us to fill some of these gaps. So out of the top most 8 here reported diagnoses, there were 4 that had significant data with more specific information. And so first off, vision. This is already pretty well documented in the literature, and the Simons data basically just confirms previous findings. You know, most frequently we see farsightedness, astigmatism, cross-eyed. Another one, we have gastrointestinal, also very well documented in existing literature. And in the Simons data, everything pretty much ran parallel with existing literature. So, you know, we have constipation pretty frequently reported, and we have, you know, that may run in tandem with hypotonia, reduced mobility, and we all know like the connection between the brain and the GI tract. So some dysregulation with that is very common in neurodevelopmental syndromes. And so here we go, yes. And so another one of the diagnoses that had a large amount of extra data was infectious disease. And so here we could see on the graph, so we have the types of infectious disease, and then the percentage of individuals in this data set that were seen with these types of symptoms. So we have otitis media, which is essentially just inflammation or infection of the inner ear. We have pneumonia, we have UTIs, and so those are some of the most commonly reported infectious diseases across the MED13L cohort. But otitis media is the most commonly presented. And so this predominance, you know, could be due to anatomical or functional vulnerability in individuals with MED13L, because they may have, you know, these structural abnormalities, or sometimes hypotonia, feeding related challenges that can increase risk of ear infections. But really, this is indicating that more needs to be done to know what this means and if other infections could occur as a result, right? So another thing to note is that out of the general population, otitis media is seen most frequently in the early pediatric age group. And so its prominence in the MED13L cohort really just raises important questions about whether these individuals have increased vulnerability, or if the trend is simply just reflecting normal pediatric incidence. So that's something just to keep in mind. And finally, endocrinologic had a lot of extra data. So just over 50% of individuals, you can see here on the left, over 60% of individuals reported no endocrinologic symptoms. So that suggests that endocrine involvement is not universal to MED13L syndrome. But here we can see, some of the ones that were higher up. We have failure to thrive, which was most frequently reported, usually classified when the child is like not growing at all. There's not a growth curve there. And currently there was a publication from the NIH just stating that failure to thrive affects about 5 to 10% of the general pediatric population. So here we can clearly see that rates of failure to thrive in the MED13L population are substantially higher. We also see short stature second most prevalent here for symptoms, which brings up this interesting dichotomy. We have this small reporting, but still there, reporting of obesity. And so it really makes us wonder, is there something unique with MED13L that may drive a kid towards growth deficiency or obesity? Like maybe it's a point in development or a certain variant where this starts to diverge. And so that was one of our takeaways from this data that we were definitely going to use for further research. And here we can see hypothyroidism. We have irregular menses, precocious puberty. All of these are related to puberty, right? And so hyperthyroidism is it's not reported here as very common. And that may be partially a result of underdiagnosis, underreporting. We have these symptoms that like failure to thrive and short stature are very readily observed by caretakers, by families. And so that could be one of the reasons for such a large discrepancy between the two, because it's a lot harder to tell, oh, does my child have hypothyroidism, rather than is my child maybe struggling to grow. Additionally, because hypothyroidism, along with these other smaller categories, do not really happen until a child goes through development, it's really important to get a large enough snapshot to see information as children are growing, right? Going through adolescence, because this repeated longitudinal data, especially at critical points of development, can help us to really understand what is going to happen when my child grows up, when they go through puberty. How does that impact these other parts of the endocrine system? So beyond the core medical features, it's important to also understand how these clinical features affect daily life. And that is where behavioral data becomes super valuable. So I analyzed this data set, CBCL. And so as we saw above in the beginning of the presentation, about 25% of individuals with MED13L have reported an autism spectrum diagnosis. And so these CBCL scores, which is a child behavior checklist, which many of you guys may have taken part in, can really help to indicate elevated social, wow, that was fast, and regulatory challenges consistent with behavior linked to autism spectrum disorder. And so first off, just some of the social behaviors, here we have the behaviors on the x-axis and the percentage of individuals, again, on the y-axis, the green being often true, orange being sometimes true, blue being not true. And so we can see here that, answering people, so the child's ability to respond when a child is speaking to them is most frequently reported occurring in individuals with MED13L. So we have some preserved social reciprocity, which is really wonderful. We see like avoid eye contact, upset when separated, are also quite high in the sometimes trues category, which could suggest difficulties like separation anxiety, eye contact, but it's not universally present. And then we get into some of the restrictive and repetitive behaviors. So same orientation of the graph. And here we see, inability to wait. We see a large percentage of MED13 individuals struggle with patience, right? And additionally, unable to change routine. About 68% of individuals express struggle with patience. And so we also see a decent amount of gets into everything. So meaning like tendency to be super curious, maybe a bit impulsive, a bit intrusive. So that's super interesting. And finally, on the far right, destroys own things, has the least amount of endorsement. So that suggests, destructive behavior is not common. And finally, we have the sensory related behaviors. And so same orientation, once again, the data really just suggests here individuals can get easily frustrated, often restless, hyperactive. And it does suggest that unhappy for no reason or getting into fights is not super characteristic for MED13L individuals. So just overall, behaviors may mirror traits seen in autism spectrum disorder, but it's often with less severity and more variability. So there's a large presence of behavior challenges with emotional regulation, sensory processing, or an inclination for repetition, routines, comfort. But the MED13L cohort experiences emotional dysregulation and sensory arousal, which really supports the need for therapies or strategies that focus on attention support. However, despite these social delays, many children showed strong receptive engagement, such as in the answering people category, which is super beneficial for interaction. All right, so finally, and this is going to be super quick, I promise, we go into just a little bit of correlation between the genotypes and these diagnoses, right? So here is just some of the genetic variants that which previous people have already talked about. So we see a large majority of the variants are frame shift and nonsense. So just suggesting, truncating mutations as seen in the literature are linked to these more challenging clinical profiles due to the loss of protein function. And here, this is kind of a variant diagnosis, or what we would call a genotype-phenotype correlation. And so I analyzed this distribution of the reported phenotypes on the right here with the variants on the x-axis, and each bar represents a variant type, and the segments which in each bar, within each color, shows the count of individuals who reported a given phenotype. And so here, these are also just the top 20%, which were showed earlier, of occurrence. And so we see here that neurodevelopmental traits like intellectual disability, language disorder, and neuro symptoms take up the large percentage relative to the other traits. And vision is also relatively prevalent amongst all mutations to MED13L. So really suggests that heavy correlation with MED13L syndrome. And so final takeaways, I looked specifically at some of the diagnoses that involve multiple systems. So, the cardiac, respiratory, renal complications, seizures, and here neuroseizure, just note, this is the presence of seizures. And so 27 individuals report at least one severe phenotype, but this data suggests that severe phenotypes, may not be confined to a specific class of genetic variant, and makes us think, could multi-system diagnoses be due to location rather than type of variant? And so that is something that really sparked our interest for future research. But it is important to note that while this clinical presentation may be more severe or overt, it's not quite enough data to be able to make a ton of conclusions just based on the numbers. So it's really important to be able to get more data on multi-system involvement to generate some more conclusions and correlations. And finally, overall, just MED13L presents a very wide and variable clinical picture. But with this Simon's data and the rare X both being caregiver reported, we can really begin to see more consistent patterns, specifically in language delay, intellectual disability, and vision issues. And the CBCL data, that behavior data, really shows the early signs of MED13L. So this is something that it's such a powerful tool. It can help you guys, parents that are getting these new diagnoses for their children, be aware of the behaviors and the symptoms that their child will experience. And therefore, it can help you guys to start the conversations with therapists, with neurologists, with pediatricians earlier on, and start those interventions to help with these behaviors, this frustration, inflexibility, sensory dysregulation, which often can emerge before these formal diagnoses are made. So it can really help to get early on treatment to be able to optimize the lives of your children, which is super, super important. It can improve not only the lives of your children, but also the lives of you guys and your families. And, the Simon's data reaffirmed findings in the literature with truncating mutations, associated with more severe phenotypes. But surprisingly, severe or more multi-system complications weren't confined to one mutation type. So we do need more research to be able to clarify those. But that was one of our key takeaways. And finally, something that we really want to emphasize is that there are clear gaps in the puberty and adolescence related traits. So this longitudinal follow-up is super critical to really understand how the syndrome evolves over time. So keep making sure to fill out these surveys and follow up as your child develops is super important for research and to be able to improve the lives of all of you guys and your children. So I just really want to say, first off, before I say my thank yous, Dr. Bain had mentioned earlier that we did recently get the Simon Searchlight version 13, which is super exciting because that means we get to learn even more and help you guys even more. But what I did my research on was version 12. So we have more to come later. And yeah, so thank you to everyone. First off, Rachel, she's awesome. Dr. Bain, they've been working with me over the past few months, and I'm so grateful to be able to have access to this data and analyze it and engage in such enriching discussions. But truly, we want to thank you guys because without you guys, we wouldn't have any of this data. None of this could be done without your participation, filling out surveys, and as a whole, this caregiver and parent reported data is just so valuable. And because of you guys, we're able to better the lives of so many others with rare neurodevelopmental disorders. So thank you.